Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see some questions from cardiovascular system, that is cardiac medications we can see, and the questions which I selected in this video is from based on the previous question paper, and this will help for your coming exam. We can see the questions. First question, what is the action of cardiac glycoside? And the options are option A positive inotropic, option B negative chronotropic, option C negative dromotropic, and option D all of this. Here question is what is the action of cardiac glycoside, and the answer is option D all of this. Cardiac glycosides are mainly used in case of congestive heart failure. Okay, one example for this cardiac glycoside is digitalis or digoxin is an example for cardiac glycoside. This is also used in case of atrial flutter or supraventricular tachycardia and all. It is used, but mainly it is used in case of congestive heart failure. And this main action is positive inotropic. Positive inotropic means it helps to make the contraction of heart muscles, and negative chronotropic. This chronotropic effect means negative chronotropic means it interfere with the heartbeat, and negative dromotropic effect means it interfere with the rate of heartbeat and it helps for conduction. Okay, that is the action of cardiac glycosides. Question number 2. Therapeutic index of digitalis is. Options are option A 1 to 2 milliequivalent per liter, option B 0.5 to 2 nanogram per ml, and option C 2 to 3 nanogram per ml, and option D 2 to 2.5 nanogram per milliliter. And the correct answer is option B 0.5 to 2 nanogram per ml is the correct answer. Which of the following drug has similar action to cardiac glycosides? And options are option A digoxin, option B deslanoxide, option C amerinone lactate, and option D none of this. Here correct answer is option C amerinone lactate is the correct answer. This have same action to cardiac glycoside. Question number 4. Which of the following drug is the first line treatment for immediate and long-term prevention of angina? And options are option A nitrate, option B calcium channel blockers, option C beta blockers, and option D both A and C. Here the correct answer will come option A nitrate. Nitrate are an example of vasodilators. Here it is used for the treatment of immediate and long-term prevention of angina. Angina means is a chest pain which happens when the heart is not receiving enough oxygen. This nitrate is a vasodilator which mainly helps to dilate the coronary vessels and helps to increase the oxygen supply to cardiac muscles. So this correct answer for this question is option A and nitrate, which is used in case of long-term prevention of angina. And next question, an example of nitrate is. Options are option A nitroglycerin, option B nicardia, option C nifedipine, option D verapamil. And the correct answer is option A nitroglycerin is an example of nitrate. Nitrate are vasodilators. Question number 6. Action of beta adrenergic blockers is. Options are option A it decreases force of contraction, option B it lowers oxygen demand, option C both A and B, and option D none of this. Here correct answer is option C both A and B. This beta adrenergic blockers mainly used in case of hypertension, angina and all. One example for this beta adrenergic blockers is atenolol. Okay, this main function of this beta adrenergic blockers is it decreases the force of contraction and also lowers the oxygen demand. Here correct answer is option C both A and B. Question number 7. Example of beta blockers are. Options are option A propranolol hydrochloride, option B atenolol, option C metoprolol, and option D all of this. Your correct answer is option D, all of this. That is propranolol, atenolol, metoprolol, all are the example of beta blockers. Question number 8. Why beta blockers are not abruptly withdraw from the patient? And options are option A, it result in angina. Option B, it elevate cholesterol level. Option C, it causes GI disturbance. And option D, both A and C. Your correct answer is option A, it result in angina. Beta blockers are not abruptly withdrawn from the patient. It may cause, if you are doing so, it may cause angina or chest pain to the patient. Question number 9. Use of calcium channel blockers. Options are option A, prevention of complication of post-MI. Option B, acute and long-term prevention of angina attack. Option C, angina caused by vasospasm. And option D, all of this. Here, correct answer is option D, all of this. These calcium channel blockers are used to prevent the complication of MI, and also it prevent the angina attack, and also it is used to reduce the angina caused by vasospasm. Mainly this calcium channel blockers helps to stop calcium entering into the cells of heart and arteries, and this calcium channel blockers also used to lower the blood pressure. Okay, here all of is the correct answer. And next question, 10th question, commonly used calcium channel blockers are. Options are option A, nifedipine, option B, verapamil hydrochloride, option C, nicardipine hydrochloride, option D, all of this. And the correct answer for this question is option D, all of this is the correct answer. These all are used as a calcium channel blockers. And the next question, question number 11. Digitalis preparation used with calcium channel blockers or beta blockers may result in. Options are option A, bradycardia, option B, heart block, option C, pneumonia, option D, both A and C. Your correct answer is option D, both A and C. That is bradycardia and heart block can occur when this digitalis preparation is using with calcium channel blockers or beta blockers. Which electrolyte level should be monitored while using antidysphotic agent? And options are option A, potassium, option B, magnesium, option C, calcium, option D, both A and B. Here correct answer is option D, both A and B, that is potassium and magnesium should be monitored while using antidysphotic agent. And the next question, question number 13. Which among the following is an example of ACE inhibitors? And options are option A, reserpine, option B, methyl dopa, option C, enalapril, and option D, all of this. Here, option C, enalapril is an example of ACE inhibitors. ACE inhibitors means angiotensin converting enzyme inhibitors. This is mainly help to relax the arteries and veins of the heart and helps to lower the blood pressure. Question number 14. Which test is used to monitor heparin activity? And options are option A, prothrombin time, option B, activated partial thromboplastin time, option C, ESR, option D, all of this. Here question is which test is used to monitor heparin activity, and the correct answer is option B, activated partial thromboplastin time. Question number 15. Antidote of streptokinase is. And options are option A, aminocarbonic acid, option B, protamine sulfate, option C, naloxone, option D, none of these. Here correct answer is aminocarbonic acid is the antidote of streptokinase. Option A is the correct answer. This option B, protamine sulfate. This is an antidote of heparin. Heparin is an antidote of protamine sulfate. And naloxone is an antidote for opioids. Here streptokinase for aminocarponic acid.